Hello, I'm Dr. Matthew Zirwas, and this is a short video so that you know what to expect during the process of patch testing. So the first thing to know is that patch testing is the only way to find out if there is something that you are either coming into contact with or ingesting that is causing your rash. There's no way for me or anyone else to look at your rash and know for sure if there's something that you're touching or ingesting or not. And there's no way for me or anyone else to know for sure if there is a thing, what that thing is. All right, so patch testing is really the only way to get that information. Now, here's what the things that I think are really important for you to know to expect this week. So when you come in for patch testing, you're going to come in first on a Monday. On the Monday that you come in, we are going to tape a whole bunch of little metal discs to your back. And this is actually what the little discs look like. These are called fin chambers. They're made on a special tape that we get from Finland because I know we certainly see a lot of people who have problems with tape. But each of these little discs is then going to get a small amount of an allergen put in it. And so here's what the allergen comes in these little tubes. And my nurses, for each thing we're going to test you, we'll put a little bit of the allergen in one of these discs, and then that's going to be repeated hundreds of times with many different allergens. Now, in terms of what we test people to, there's a certain list of common things that everyone gets tested to just because they're so common for people to be exposed to. So that's going to be ingredients in shampoo, conditioner, moisturizer, soap, laundry detergent. It's going to be the things in your clothing, the fabric finishes, the dyes. It's going to be the things that you're touching, metal objects, rubber objects, plastic objects. It's going to be things that are in the air, things that are in food, the things that we're all exposed to all the time that I know for certain, based on all the patients that I've seen over the years, are common causes of allergic contact dermatitis, whether you suspect it or not. All right, so what does that look like? Well, this is our refrigerator of allergens. So in here we've got several hundred allergens that, depending what we decide after we meet with you and talk to you and look at your rash, we'll decide which of these hundreds of allergens we're going to test you to. And for most of our patients, it ends up being somewhere between about 90 and 120 different substances that we test you to. All right, but so now that you've got an idea of what these little discs look like, so essentially we're going to put allergen on all of these, and then we're going to tape them all to your back. Now, if your back is broken out, we can use other parts of the body, usually the thighs, sometimes the arms, sometimes the chest area, but we just about always can find somewhere to put them. So we're going to tape these to your skin, then we're going to cover them with another layer of protective tape. All right, so that's when you come in on Monday. So then from when you get here on Monday, for the next about 36 to 48 hours, we want you to be really careful to try and avoid sweating or moving too much. Anything that really is going to make that tape come loose. All right, so after you leave here Monday, try to avoid sweating the rest of the day Monday. Tuesday, you can't get a shower. So you can't get a shower after you leave here Monday. You can't get a shower on Tuesday. And then Wednesday morning, whenever you wake up in the morning, this can all come off. And so you can come in here to our office and we can take it off. Or if you have someone at home, they can take it off. So it's going to come off on Wednesday. After it comes off Wednesday, you can get a shower. Now, we want to certainly avoid washing the back, and the main thing is we will have written on your back with magic markers so that we can tell exactly where each disc was. And through the course of the week, you're going to need somebody to look at your back after the tape comes off and make sure that the marks that we made are still there, and if they're starting to come loose, to remark them. All right, so after the tape comes off on Wednesday, pretty much you can go back to your normal routine. You can shower, just kind of avoiding washing your back. But if it gets wet, that's no problem. You can sweat, you can do whatever else you want. But when you take it off on Wednesday, just expect this. Your back is going to be really broken out just from having the tape on there. It's going to look like you're reacting to a bunch of the things we're testing to. A bunch of them are different colors, so some of them are red, some of them are brown. Don't worry about any of that. So everybody's back is broken off whenever it's breaking out whenever we take the tape off. That's why we have you take it off on Wednesday, then we wait and we don't see you back until Friday. So on Friday when you come back in, all of that non-specific, just irritation from the tape will be gone, and on your back we'll be able to see, did we recreate your rash, any red welts under one of those little discs. That then tells us that you're allergic to whatever the substance in that disc was. Alright, so that's how the whole process is going to work over the course of a week. Many people have had patch testing done before. The things that I can tell you primarily that for the most part, other than very specialized centers like ours, patch testing is not very accurate. And so even if you've had patch testing done before, really unless it was done in Cleveland at the Cleveland Clinic or down in Cincinnati with a Dr. Toby Mathias, really our results are going to be more accurate and more useful than anyone else's. Last things to tell you, antihistamines. So Benadryl, Atarax, Claritin, Zyrtec, Allegra, any of them, you can continue to take those during the testing. If you're on prednisone, give us a call at least a couple of weeks before the testing. You want to try and keep sunlight off of your back for at least a week before the testing. You want to avoid going to tanning beds for at least a week or two before the testing. You want to avoid putting topical steroids on your back for at least a week before the testing. The rest of your body, anywhere we're not going to put the tests, it's fine. You can put whatever you need to put. All right. So again, if you're getting ready for the patch testing and you have any questions, certainly don't hesitate to give us a call and ask us. And then the last thing is, in anything that you suspect might be related to your rash, we want you to bring with you to your patch testing appointment. So it varies based on where the rash is. If it's on your hands, any gloves that you wear, any soaps that you use, any moisturizers that you use. If it's on your feet, it's going to be your shoes and any creams or medications that you put on your feet. If it's on your face, your shampoo, your conditioner, your facial cleanser, your facial moisturizers, your makeup. If it's on your hands and you suspect it's related to your job, try to find out whatever you can about the chemicals that you're exposed to at work. So depending where it is on your body, we're going to want you to think about it and bring things in with you. Also, if you use essential oils or anything like that, we'll want you to bring those in. But that's about everything that you need to know about patch testing. If you have any more questions prior to your patch testing appointment, don't hesitate to give our office a call. Thanks.